I'm Dr. Beyer. Welcome to treatment success secret number 8 for migraine headaches. And in this one, we're going to talk about the importance of having your blood glucose or your blood sugar levels within the right range. If you remember, in success secret number 7, I talked about a different metabolic problem that can oftentimes be a component of chronic headaches, and that was an anemia. And in that success secret, I talked about how the nervous system, while it's only 2-3% of your body weight, can consume like 20% of the oxygen. And so subtle decreases in the body's ability to carry oxygen can really have a significant impact or negative impact. And it's the same with blood glucose, because the amazing thing about our body is that every tissue in our body can get energy from either glucose or blood sugar or proteins or fats. The main energy source is glucose, but all the cells in the body, except for the brain cells, can also get energy from proteins or fats. But the brain cells or the neurons, they're not equipped to be able to absorb and utilize proteins or fats for energy. So the point is that if there is an imbalance, either too high or too low, of the blood glucose levels, then that really has a very negative impact or effect upon the brain or the nervous system, because it can only get energy from glucose. So a lot of people with migraine headaches, they have these blood sugar irregularities, or these dysglycemias is what we call them. The blood sugar sometimes is too low, that's hypoglycemia, or it's too high, which is insulin resistance. If it gets up high enough, it can be diabetes, of course. And when it's too high, that's a problem, because the blood sugar is elevated because it's not getting in the cells where it needs to be. So a lot of people who are having headaches, they have these dysglycemias, and a lot of times, like all these other metabolic problems that we work with patients, they're undiagnosed. They're there, and people have them, but they just don't know it because they're working with a doctor who missed it because they're using, or they're looking at these lab ranges, and as long as you fall within the lab range, then you're going to be told you're normal. Like, for example, blood glucose, the optimal range should be 85 to 99. Labs will go from 65 to upwards of 110. Your doctor won't care, if you're 70 or 75 if your blood glucose is there, but that's too low, and that's hypoglycemia and could be contributing to your headaches. So give the office a call. We do functional neurology and functional medicine. We metabolically look at people and look to see what kind of contributing metabolic imbalances there are, but do so with a functional metabolic or functional medicine approach, which picks up a lot of these problems that people have. Give the office a call, 815-469-8500. You set up an appointment to come on in and do a consultation exam and see if you're a good candidate for treatments. We've given just a lot of people over the years, thousands of people over the years, relief with severe debilitating headaches, and you could be the next one. Just give the office a call.